same as a human ophthalmologist, except we see every single species with eyes with the exception of humans. You kind of fall in love with the vast majority of your patients.
We didn't have access to cataract surgery back then.
Did a cataract surgery on a great horned owl one time. It woke up partway through surgery, so flew into the microscope. That was interesting.
And all of a sudden she could see again.
Yeah.
And her eyes just lit up, and she just like looked around, looked at me, and it was like they had their dog back. It was so beautiful.
It really is. It's pretty phenomenal when you get to see that.
Today we have a very special guest, Dr. Marnie Ford. She is a veterinary ophthalmology specialist.
Oh, thanks, Melinda. I'm really glad to be here.
A lot of people might not even know that there is such a thing as a veterinary ophthalmology specialist.
Right.
What does that mean, and what was your journey to get there?
Yes, I'm a veterinary ophthalmologist, which is essentially the same as a human ophthalmologist, except we see every single species with eyes with the exception of humans. So I started out in vet school like everybody else, did the 4 years, and then followed up with a year internship and then another 4-year specialty. And this is exactly the same as how it goes with human ophthalmologists as well. And then once you're an ophthalmologist, you can certainly go even more specialized into specific areas like human ophthalmologists, but more often than not, we will stick to every part of ophthalmology.
In a typical week, what kinds of cases would you see in your specialty practice?
As far as species, I see a lot more dogs than anybody else, but a close second would be cats. After that, we'll see horses, a lot of wildlife, a lot of birds.
What would be some examples of common things that people might take their pet to an ophthalmologist for?
The most common thing would be an acquired injury. Of that, I would say corneal ulcers would be the number one thing, or traumas related to a scratch, like a dog getting a scratch from a cat or from a bush or something like that. Then we have a very close second, I think, would be glaucomas, and that's more of a dog issue than anything else. The glaucomas that are typically genetic in origin, but sometimes acquired secondary to traumas as well. That's another big one. And then cataracts. That would be probably number 3.
Cool. Do you have any specific cases that come to mind as far as the ones that have been the most gratifying or most rewarding cases?
There's so many that are gratifying that it's hard for me to really nail down one in particular. But, you kind of fall in love with the vast majority of your patients. So, anytime that they get better, then you don't get to see them anymore. It's always a little bit sad, sort of bittersweet. I've had some really interesting patients. I've had some sea lions, dealt a lot with seals, did a cataract surgery on a great horned owl one time. They're tricky because it woke up partway through surgery, so flew into the microscope. That was interesting. Surgery was done. No, surgery was done. It wasn't that way. He actually did really, really well, but it was just one of those ones that stands out in your mind a little bit.
I could imagine for an animal like an eagle or an owl that has such a highly developed sense of vision. I remember I used to work in a laboratory where one of the researchers, he was a neuroscientist, and he had a brain library, every single species of animal, from dolphin to elephant, everything, humans, dogs. I remember we looked at it, and all of the birds of prey that have really highly developed sense of vision, the optic part of their brain, like the cortex and the optic chiasm, basically cables carrying the visual sensory information, were so highly developed. It was like amazing.
It's pretty amazing. And then you look at a creature like a dog, for example, who actually has a very, very poor sense of vision comparative to humans, for example. People always think their dogs are so highly visual when in fact it's their sense of smell in their brain. It's just so developed. So it's really neat. It's all based on, their lifestyle. What do they do? How have they evolved? It's incredibly interesting. Love it.
I remember the first time I ever saw cataract surgery, there was an Irish setter that came through on the ophthalmology rotation. She had cataracts and was completely blind. They just loved her so much. You know how Irish setters love to run and they hold their head high? She was just terrified, like head to the ground, terrified of every step. She just wasn't herself at all. And then I was with her when she woke up from the cataract surgery, and all of a sudden she could see again. And her eyes just lit up, and she just like looked around and looked at me, and it was like they had their dog back, and I was like crying. It was so beautiful.
It really is. It's pretty phenomenal when you get to see that. When you're in the back treatment room and there's dogs waking up in their cages after cataract surgery, and they're watching you go around the room when before they were just staring because they weren't seeing anything. It's pretty cool. It's pretty cool, I must admit. Owners love it.
Growing up, one of our dogs had cataracts. He was a Cocker Spaniel.
Oh, yeah.
We didn't have access to cataract surgery back then that I know of.
No, you're right.
It's kind of new.
Yeah, in the last 20 years, it's really taken off. It's a good thing to just know that a lot of cases of cataract in dogs are caused not only to genetics, but also to diabetes. And so if your dogs are developing cataracts, especially when they come up very quickly, sometimes the diagnosis of cataracts will actually precede the diagnosis of diabetes from the clinician. So it's always something we talk about if we're seeing a patient before they've gone to their regular vet and the dog has mature cataracts that have come up very quickly. We'll often recommend that they go see their vet to make sure they don't actually have an underlying problem with diabetes. That's crazy. Cats don't do that. Yeah, it is. It's wild. People don't do that.
I remember someone said either the portal to the body.
Yeah.
But it's interesting how sometimes you can see eye problems and that really means problems elsewhere as well.
Oh, 100%.